There's a group of doctors who are helping South Africans understand the dangers of COVID-19, and they've been creating videos in all of the country's official languages to try and help people to digest the influx of news surrounding the virus. Now, Dr. Mathobela Matjekane joins me now live via Skype to tell us more about this particular program. Doc, thank you so much for your time. I suppose my first question to you is this initiative by private doctors in terms of trying to ensure that the information disseminated around COVID-19 is not only in English but in other indigenous languages?
Yes, so we work in mostly township areas around Cape Town, and we have seen that there was a lot of need for us to translate the messages that the government is sending out or the healthcare sector is sending out to patients, to try and educate them about the message of COVID-19 and making sure that they are taking care of themselves and they're practicing social distancing. Hence, we decided to put it in languages that they would be able to relate to, as is something that they always talk in every day, as they are.
And Doc, out of the 11 official languages, do you cater for all languages, or is it just some languages for now?
For now, it's still some languages. We are looking into going into more languages like Venda, Tsonga. For currently, I'm Pedi. Originally, I'm from Limpopo, so I was able to put a lot of content around Sepedi, and I was fortunate to work with doctors that speak isiXhosa. So that is mainly most of the content that we're putting out. Obviously, English and Afrikaans, those are the only 4 languages that we have been able to cover, but we are looking into putting more effort into getting more languages out so that people can understand and relate better to the messages as well.
Now, you did make mention to the fact that you are primarily based in townships, or at least you cater to healthcare needs within township areas. Have you found that with English there was some misinformation or miscommunication where patients perhaps did not understand clearly what COVID-19 was, or even its side effects or its symptoms, hence you had to resort to this avenue?
Yes, definitely. And with simple things, or even the new terminologies that we are using on a day-to-day basis on the media, like quarantine, social distancing, it's easy for us who have studied maybe to understand that, but that is not simple language for them. And even things like side effects and the symptoms, so we had to explain to them even into more detail what do we actually mean by symptoms, because some people have not experienced any of those symptoms before, so they won't know exactly what they are experiencing, but when we're explaining it in their language, they're able to relate it and understand.
Now, Doc, we've just been reporting right here on ENCA just yesterday that I think the number is 200 of doctors coming in from Cuba to assist the country, of course, with the pandemic. Is it an option or an avenue that you're considering perhaps for those Cuban doctors who may not be first language English speakers, to have them have translators if they will be assisting government hospitals or patients who are based in townships or even rural areas, so that that communication is not further broken down?
I think most of the times when doctors are working in hospitals, we always work in contact with nurses and admin staff. So I think if there isn't any proper language, if there's a communication breakdown, something has to be done to assist in that regard. But most of the time, the doctors will be dealing mainly with, if they're placed in hospital setting, meaning in day ward rounds, managing patients. Yes, there is a need for language interpretation where it's necessary.
All right, we'll leave it at that. Thank you so much, Dr. Matjekane, joining us from ClinMed, of course, raising the issue around indigenous language having to be included, of course, as we continue to raise awareness on COVID-19.
Indigenous languages. I love that. I dislike the word vernacular.
You don't?
I don't like
it.
Or
vernac.
and people talk about it as if it's an actual language. Oh, I don't speak vernac. What is vernac?
So it's an indigenous language. All right.
Indigenous languages, African languages, I can live with that. All right? You're watching ENCA.